Good morning and welcome. Welcome to the Diabetes and Special and Vulnerable Population and National Learning Series. This is the second session of our series, and we will begin in just about 2 to 3 minutes. Good morning. I want to welcome everybody. My name is Cindy Selmy. I am from Health Outreach Partners. This is the National Learning Series, the Diabetes Continuum of Care, Intersectional Identities of Health Center Workforce and Patients. This is part of the Diabetes and Special and Vulnerable Population Task Force National Learning Series. We will begin in about 1 minute, just giving folks a chance to come in and get situated. All right, we're going to go ahead and start. Welcome, everyone. Welcome to the National Learning Series, sponsored by the Diabetes and Special and Vulnerable Population Task Force. We're very happy today to bring you the second webinar training in our series, Diabetes Continuum of Care, Intersectional Identities of Health Center Workforce and Patients. Diabetes affects 37 million people in the U.S. This is the third year the Special and Vulnerable Population Diabetes Task Force has engaged health centers and other health organizations by hosting the National Learning Series. This series is funded by the Health Resource and Services Administration, HRSA, and the Bureau of Primary Health Center program in response to the 1 in 7 community health center patients living with diabetes. Our multi-tiered strategy is to support health center patients control, manage, treat, and prevent diabetes. Please visit our website at chcdiabetes.org. The Diabetes Task Force is made up of 14 organizations forming the National Training and Technical Assistance Partners. Please visit our website to learn more about our organizations, but you can see a snapshot here on this slide of the organizations that make up our task force. So welcome to our series. This is the second webinar in the series, and we're certainly happy to have you here with us today. It is not too late, however, to register for session 3 and session 4. Both of these sessions will be held next week. And on Tuesday, December 13th, we will have emergency preparedness for diabetes management. And we will wrap up the series on Thursday, December 15th, with environmental impacts on diabetes access to care. You can register at chcdiabetes.org. This session today is CEU units are available, and we want to let everyone know that none of our faculty or guest speakers has any conflict of interest or any relationship with a commercial pharmaceutical company, a biomedical manufacturer, or any other perceived or vested interests in therapeutic areas. If you wish to receive continuing education units, Migrant Clinicians Network is providing those for us today. Please reach out to them directly. And at the end of this webinar, there will be a short survey to fill out, and that will assist you in receiving those units. All right, I'm ready to go ahead and introduce our team here. My name is Cindy Selmy. I'm the Executive Director of Health Outreach Partners. I will serve as the moderator for our session today. I also want to introduce Mason Dunn, JD, Deputy Director of the Fenway Institute, and he will be assisting me as we proceed. We have a great faculty today joining us. So please, let's welcome Anna Collins. She is a senior consultant for Quat Associates. Quat Associates is a management consulting firm that works with nonprofit organizations on compensation and performance management systems. I want to welcome Anna. Also want to welcome Fatima Smith. Fatima is a project manager for the National Nurse-Led Consortium. And finally, we will have Jillian Hopewell, Chief Program Officer for Migrant Clinicians Network. We will have 3 learning objectives for our session today. First, we will discuss the impact of provider burnout on diabetes care and explore how to allow more agency and autonomy throughout the care team. We shall discuss intersectional identities and staff reflecting patient populations and how this relates to staff retention. And finally, we'll explore tools, resources, and assistance in addressing provider burnout, moral injury, and stress in order to improve diabetes management for patients. And with that, I'd like to introduce Fatima Smith, and she will be presenting on addressing provider burnout and allowing more autonomy throughout the care team. Fatima, welcome.
Thank you. Thank you so much, Cindy. You can go to the next slide. So prior to the pandemic, healthcare was experiencing its own epidemic, and that would be burnout. You can go to the next slide. In 2017, long before the pandemic, researchers at the Institute for Healthcare Improvement released a white paper titled Framework for Improving Joy in Work, which focuses on joy in work. So we have them to thank for bringing this to the forefront of healthcare. Their argument is that increasing joy in work is an essential part of improving quality for patients and employees as this clinical skills. We support this ongoing discussion because we see it as a key area for improvement. You can go to the next slide. Some of the benefits as outlined in the white paper include greater professional productivity with lower turnover rates, improvements in patient experience, fewer medical errors, outcomes, and safety, less waste, higher employee productivity, resulting in substantially lower costs, and more discretionary effort on the part of staff. and also reduce turnover, leading to better financial performance. Next slide, please. This slide outlines 4 steps leaders at all levels can take to support joy in work. The steps are depicted as stairs to illustrate that each step serves as the foundation for the steps that follow. So for the first one, leaders are encouraged to engage colleagues and staff to identify what matters to them in their work. The second one is to identify the processes, issues, and circumstances that are impediments to what matters, the pebbles in their shoes. So that those are things that get in the way of meeting professional, social, and psychological needs. The third one is leaders can, in partnership with multidisciplinary teams, come together and share responsibility for removing these impediments, focusing on the 9 critical components, and which we'll show you in a later slide, and for improving and sustaining joy. And the last one, leaders and staff can use improvement science and data together to accelerate improvement and create a more joyful and productive place to work. Next slide, please. While the 4 steps shown previously are designed to provide leaders with a pathway for how to get from here to there, the IHI framework for improving joy in work seen here shows the critical components of a system for ensuring a joyful, engaged workforce. Each of these components is discussed in great detail in the paper provided in the resources at the end. The 3 outer rings of the framework show who is responsible for these components. Senior leaders are responsible for all 9 components. Managers and core leaders are responsible for 5 components, and individuals for 3 components. The responsibilities depicted are meant to help leaders assess and plan for ongoing development of behaviors and systems at all levels that we can improve on. Next slide. Here are some more developments of the components. An important note on the development of the framework with Maslow's hierarchy of needs in mind, the IHI framework identified there are 5 fundamental human needs that must be met to improve joy in work, and they play a central role in the framework. They are physical and psychological safety, meaning and purpose, choice and autonomy, camaraderie and teamwork, and fairness and equity. Next slide. Team-based care is at the core to developing increased joy in work. According to the National Academy of Medicine, team-based care acknowledges that multiple key players are treating a patient and that each must work with one another to drive optimal care outcomes. Members of a care team may include doctors, nurses, physician assistants, specialists, and other non-clinical professionals who are integral to caring for a patient. Next slide. So why should team-based care be practiced and joy promoted in the workplace? High-functioning clinical teams are essential for the delivery of high-value healthcare and have been associated with the following: decreased workloads, increased efficiency, improved quality of care, improved patient outcomes, and decreased clinical burnout and turnover. Next slide. This is a resource for consideration. Team Steps is an evidence-based teamwork system designed to improve quality, safety, and efficiency of healthcare. It is practical and adaptable. AHRQ is doing an ongoing QI on this tool and has many free resources. And next slide, please. And here are a list of resources that will be provided to you all at the end of this presentation. And I'll be passing it along to Jillian Hopewell from MCN.
Hi, everybody. Really happy to be with you all today. And want to talk a little bit more, dive a little bit deeper into some of these concepts of self-care and resilience. And really, in this presentation, just really kind of touching on some things and sharing some resources. but also want to acknowledge the fact that when you look at intersectionality and you think about healthcare providers working in often very stressful situations, and they themselves are also, or you, those of you who are here, also really dealing with a lot of your own stresses and anxieties, and trying to function in a situation in which you are trying to provide the best possible care to people who may be really under a great deal of stress themselves. So just sort of this is um, this is really a discussion of what is available to you as frontline providers and as managers of frontline providers potentially, to think about what can happen to improve your own well-being as you move along. So if you go to the next slide, I just want to talk about the fact that again, if you're looking at something like the treatment of diabetes, which is what our task force is focused on, you really cannot effectively treat chronic disease if you yourself are tired, stressed, and exhausted, especially on a chronic basis. And I am sure I probably don't need to lay out all of the kinds of stress that healthcare providers have been under, especially in the last couple of years with the pandemic. But if you think about long work hours, and there are often rotating or irregular shifts, it requires both physical and emotional labor on your part. You're exposed to suffering in many cases, and you are also yourself at an increased risk of exposure to disease and violence. And then also you're also dealing with, again, some of those intersectional issues where you yourself may be dealing with things that are very stressful. And if there was a um, survey it was published in Mental Health America in 2020, and in that one, 93% of the healthcare workers reported being stretched too thin or very stressed. 82% shared that they felt emotionally and physically exhausted, and 45% of nurses reported that they were not getting enough emotional support. So if you go to the next one, there is a woman, Dr. Kata Weingarten, who works with Migrant Clinicians Network, and she developed something called the witnessing model. She developed it about 30 years ago, and it's a combination of bystander theory. And Cindy, if you click through, there's some. Yeah, there you go. Which is sort of the unintentional witnessing or overexposure to violence, violation, hardship, or stories, which can then become toxic for people. And then trauma theory, which looks at your sort of levels of secondary trauma potentially. And so the purpose of the witnessing model is to reduce the impact of this toxic witnessing and to really promote self-care. And I'm really just going to touch, because there's other things that we're talking about today too, but I really want to share touch on what some of it means, let you know that there's a ton of other resources available. And so we'll move on from there. And I think the key point to raise with all of you is that witnessing other people's struggles and challenges can create a level of toxic stress for yourself if you don't take care of yourself. I would say conversely, there is also something that Dr. Weingarten talks about, which is vicarious, sort of vicarious positive support as well. So you can also gain positive things from witnessing positive interactions, people getting better, and that sort of thing. So just something else to keep in mind. So self-care can mean a lot of different things to a lot of people. But if you go to the next slide, it's not selfish, is one of the things that we want to emphasize. And it doesn't necessarily take a lot of time. And so if we go to the next slide, so you look at what it is. So it's anything that you do to take care of yourself physically, so that you can stay mentally and emotionally well. It benefits your overall well-being. It is not necessary, or it is necessary, excuse me, to promote positive health outcomes for yourself. It strengthens your resilience. It helps cope with daily stressors, and it helps cope with high demands of challenging times. And it's not if you go to the next slide, it's a development of a level of resilience, which is not to say that you should ignore what's happening or somehow not be really very present, but it helps to develop that, you know, your ability to respond with the understanding that no one is resilient all of the time. So if you think about traumatic and stressful events and people living within a resilient zone, um, and as trauma happens, you, if you move to the next slide, you kind of ebb and flow within that generally resilient zone that you can stay within, right? Or that you can work with. But then sometimes we just get, if you go to the next slide, if you just get, there's a traumatic or stressful event that just pushes you beyond what your normal resilience can manage, and you get stuck in this high zone, which can be characterized by irritability and anxiety, speedy thoughts, feeling really jittery, not being able to really focus. Conversely, you can get stuck in the low zone, which is the next slide, Cindy, which leaves you feeling depressed and fatigued and no energy and isolated and all of those sort of low level pieces. And then, of course, going to the next slide, you can shift between high and low. So really what we're talking about, if we were to go back to, we don't need to go back to it, but the resilience slide is like developing your own ability to sort of either expand that zone of resilience or strengthen that zone of resilience that you operate within. And then to understand that everyone has strengths in a crisis, and not even a crisis, just your work, you know, where you work, and your strength is probably very different than somebody else's, and that's, you know, that's totally fine. But coming to a place where you can recognize what your strengths are, and that is a lot of the work that we do through the witnessing program, is to try and help people to figure out where are their strengths, how can they call upon those strengths when times get particularly difficult and they're dealing with and, you know, dealing with challenges at work, in this case in the healthcare setting. And I also just want to emphasize, this is something, this is something that Dr. Weingarten emphasizes quite a bit, which is that hope, she talks about hope as a verb, not a noun, and hope is something that we do with one another. And there's a number of ways to think about developing a sense of hope, or of engaging with other people in hopeful ways, so that you, again, just by sort of going through some of those processes, you both develop your resilience, and it's a form of self-care. And I think if you move on to the next one, Cindy, you know, one of the things that is emphasized in the work that Dr. Weingarten does is that it's not trivial to do a small either act of self-care or engagement in a really positive way with people, or understanding the sort of the impact, the small ripple effects that can happen from a single small event. So while we in no way ever want to diminish the severity or the degree of the challenges that people face, the understanding that you don't necessarily have to, you don't have to create wholesale change in order to begin to develop your own muscles around resilience and self-care. So some of the things that the witnessing model offers, we understand that not everybody has the same capacity. So we offer a variety of different resources for people to take advantage of, depending on what they're able to do. So we do offer much more in-depth national online seminars on a number of different topics. We also have peer support groups where healthcare workers have the space to meet with their peers and share and connect with one another. We have learning collaboratives for managers, and I would highly encourage that for people who do manage other people within the healthcare space. So it has a number of strategies for working with your team. And like Fatima talked about, the looking at your team-based care and how as a manager do you create spaces where that team can be as the highest functioning, healthiest team that you can. And then we have a number of different resources on different topics. And the goal with the resources is to make sure they're short and easy to read and that they're timely and relevant to the group. We also place a real value on creativity and innovation. So we have a podcast, which is on the following slide, Cindy. I encourage you to take advantage of it. It's on Spotify. You can get it on any podcast platform, whatever you may use. They're pretty short when they're not like an hour long, and I think that they're just a really helpful resource for people. And we have this resource that we've developed. It's a comic book. It was developed in really for anybody, but because I think all of us can respond to visual resources, but it was developed specifically for community health workers and people working at the front line during the COVID pandemic, and thinking about how you can better support yourself and also the people around you. So with that, I want to turn it over to our colleague, Anna Collins, who's a consultant with Quad Associates, and just a little bit of kind of so you understand the transition here. I think as members of healthcare organizations, and it's really critical to understand that both your satisfaction and the people you work with, and perhaps the people that you manage, their satisfaction is impacted by programs and resources that address, of course, the mental health and well-being. But we can't ignore the fact that well-being is also tied to financial stability as well as equity among employees. And if you think about the intersectional nature of employee teams or clinical teams, we need to in order for those teams to function most effectively, we really need to address issues around equity. So for that reason, we're going to turn now to some practical strategies that you on your sites can employ to better understand compensation equity within an organization. And it's a strategy that has been effectively employed, and Anna Collins is a real expert in this field. So we're really pleased to have her with us.
Thanks so much, Jillian. So I'm Anna Collins. I'm from Quad Associates. I'm a senior consultant, and just on the next slide, I'll give just a quick background on who Quad Associates is and what we do. We're a management consulting firm that works exclusively with the nonprofit industry. We do the bread and butter of our work are in staff and executive compensation systems and structures, especially for nonprofits. That executive side a lot of times looks at IRS compliance and pay. We also work with organizations on organizational and staff performance management systems. We conduct 360-degree leadership assessments, usually either for a CEO or a leadership team, and we help organizations implement succession planning processes. And so on the next slide, I've got just a sampling of representative clients that we work with who are in the healthcare and the LGBTQIA+ spaces. And as we go to the next slide, this is just sort of an intro to what a pay equity analysis is and is not. So the way that we look at pay equity analyses, they're a way to review current pay levels at an organization to determine if there are pay inequities, and that's at an individual level or at a broader, more systemic level. And if so, what potential causes might be, and a chance to recommend possible changes in human resources practices. That could be compensation practices, that could be hiring, promotions, how jobs are leveled, job descriptions, things like that, that might be creating or helping to prevent those pay inequities. What a pay equity analysis is not is a legal opinion stamp of approval, in this case, that says, yes, you're perfect, there are no inequities, just because there are a lot of federal and local regulations around pay equity, and it's something that really should be continually monitored, not we checked it once a long time ago and it's fine. So on the next slide, I'll get into sort of the process of conducting a pay equity analysis. So the way that we do them, first off, like I said, it's to help organizations identify and address both individual and broader systemic oversights and compensation practices and to begin to correct those. We always conduct our equity analyses in conjunction with a compensation benchmarking study. And the reason and sort of what that means is when we do a compensation benchmarking study, we're not looking at any demographic information. Usually we don't have any at all. We're just looking at job descriptions and what a position is responsible for and comparing that role to market data that we have through surveys and working with other clients to determine what the market value of that role is. And the reason that that's important for pay equity is it helps us look at apples to apples, because you can't look at the salary for an accountant and a lawyer and some other position and say, well, this job that is getting paid more than this person, so this job is overpaid or this one is underpaid, because the markets for the positions are very different. So by doing this market study first, we can come to a value. It's called a compa ratio, and I'll get to that in a moment, but it just gives us a percentage so that we can look at how people are paid versus the market, regardless of their job. And then we look at factors of interest that the client organization will identify for us. So there's a list on here of some that we've had clients interested in before. And the real thing to look at when you're determining those factors is what things do you want to have impact compensation? So something like how long someone's been in their role, what their performance is, that you would like to travel up as compensation goes up. And then things that you hopefully would not have impact compensation. If two people are performing the same, but they're of different ages, races, genders, that part shouldn't impact compensation. So as we go to the next slide, I'll get a little bit more into the nitty gritty on that compa ratio factor that I mentioned. All that really is we'll figure out the market value for a position, again, based on the job description, based on what the person's responsible for, what kind of experience is required for the role, and we will divide what the person is actually being paid by that market value. So if you get 100%, what that tells you is that person is being paid at the market value. If you get 80%, the person is below the market value. If you get 120%, they're above the market value. And this can be a good thing or a bad thing. There are a lot of factors that would actually mean a person should be paid a little bit above or below the market value. If it's someone who's brand new to the role, you want to have room to be to get salary increases as you learn the role and as you get into fully performing, because we've all been brand new to jobs where we don't know exactly what we're doing, and as we learn, the pay should follow that. And someone maybe should be paid above the market if they're knocking it out of the park. The organization couldn't run without them. They shouldn't just be paid that standard amount. But there are other things that shouldn't really impact pay that sometimes do. So maybe the organization doesn't have a compensation philosophy. So when people are promoted or hired, pay is done on an ad hoc basis. A lot of times, if you don't know what the market is paying, it's really hard to align what you're paying with the market. You might not have standard definitions of what makes someone a manager versus a director. And again, then those decisions are going to be made on an individual by individual basis, which is not something that's going to lead to really equitable pay practices across an organization, especially if it's a large organization with a lot of people in the same roles. So on the next slide, this is sort of the process that we'll take in conducting an equity analysis. One thing that we'll do is we'll either run a regression analysis or we'll look at individual correlations between compa ratios at the organization and some of those factors like race, gender, performance that the organization identifies. And these are just so that you can see if there really is correlation between pay and the factors that you want to have correlation with, like performance, or if there's correlation between something like pay and gender, where you might not really want those two things to have a strong correlation. And the caveat with this method is that if you're looking at a lot of factors or a very small organization, it's harder to have statistically significant results. So another thing that we'll do is we'll look at average compa ratios between groups. So if you've identified race, then we'll see which categories you have staff fall into, and we'll look at average compa ratios between those groups. And we'll see if they're coming out fairly even or if there are a lot of big differences. And one thing to keep in mind there is that if there are differences or there aren't differences, that doesn't prove that there's equity or inequity. It just gives us an understanding of where we should really be zooming in to find more specific data. And part of the reason for this is we're looking at one factor at a time. So maybe by gender, groups are coming out at different levels, but you'll realize that by tenure, one group does have a lot of more long tenured individuals than another. So with that, I'll give an example in a moment on some different things that might come into play. One other piece that we'll look at, depending on the organization size and if it's a really flat or very hierarchical structure, is that we might look at representation by some of those categories at the different levels. Because maybe you've got, a very even spread by gender across the organization, but as you get to higher levels, leadership is all men, something like that, which can also have an impact on how people are seeing their roles and how they're paid. So on the next page, I've got a fictionalized example kind of based on some things that we've seen with other clients. And this is how the results of an analysis might come out. So on the left-hand side, we've got an analysis by gender, and you'll notice that the organization is having a higher comp ratio, so that 99% is pretty close to the market for men. However, you'll notice that the average tenure and role is also a lot longer for this group. So when we take a look at a second factor, there might be a reason for this difference. In the right-hand column, there's not as clear of a story being told by comp ratio versus tenure. But if you take a look at the Hispanic or Latinx group that's coming out a lot higher in comp ratio than the other groups, there are only 4 data points there. So there may be 1 or 2 data points that are skewing that average. And again, this could be for a good reason. Maybe it's, excuse me, one superstar who's really knocking it out of the park and should be paid that high. Next slide, please. Excuse me. So that's the high level piece. Next, we'll drill down into individual by individual data. This helps us to identify high and low potential outliers and to determine if there are any patterns in those outliers. If all of the high outliers belong in one group or another that the client organization has identified that they want to look at, this is telling to potential systemic inequities at the organization. Then we'll work with organizational leadership, and usually that's somebody in HR. Sometimes we'll bring in someone with, from finance, someone from legal. And we'll discuss those potential outliers. So this can help. Obviously, we don't know as much about the organizations that we're going into. We just have demographic data on paper. So this gives us a chance to talk to leadership who can say, oh yes, this person is a rock star. They really should be paid that high. Or this person, something's happening and they're paid lower than they should be. We need to look into this. And this can be an iterative process where there's a lot of going back to individual managers, figuring out what's going on. So this helps us get that organizational insight. It also helps the organization start to think about where compensation adjustments might need to be made, or to other HR practices, like maybe we're hiring too low, and that's why we're seeing a lot of turnover. All these salaries are really low at the lower levels. As a next step, we recommend very highly that an organization, still on the former slide. Oh yes. So we recommend a legal review take place. And that's just because there are a lot of federal and local regulations, and it's good to be aware of those and make sure that you're in alignment with everything. And as far as rollout, I wish I had a one-size-fits-all answer, but it's really been different with every client that we work with. The communication of the study results is going to vary based on how much transparency the organization is embracing, and that could be based on the organization's history and culture, the comfort level of executives. We've had some organizations where the executives want us to sort of report back to their group. They go in and make the compensation adjustments and things end there. We've had other organizations where we present to their whole staff and say, here are the types of things that we looked at here overall, without revealing anyone's salary, large scale findings. So it really depends on the organization. Next slide. So a few things that we really recommend, sort of tips and tricks from having been around the block on equity analyses, is first off, we recommend that you really consider the timing on when to conduct a pay equity analysis. Since we recommend pairing the equity analysis with that compensation study that I mentioned, this can take a little bit of time, but it allows you to be looking at up-to-date market information. So you want to make sure that you have time to complete both parts of that process. Additionally, depending on your organization's budget, it's important to note that sometimes right-sizing salaries across the organization takes a while. It can take more than 1 year to make sure everybody is up to speed. So it needs to be done at a time when the organization has the budget for that. And if the organization is really restructuring at a time, since we base our analysis on job descriptions and what people are doing, it won't be relevant by the end of the study if everyone's job has changed. So timing can be important. We also really recommend working with a legal counsel so that you've got attorney-client privilege and knowledge of local and federal regulations. It's just never a bad idea to have either internal or external legal counsel involved in pay equity. And we also recommend that you start the project with a project working group so that expectations can be managed, so that staff knows what to expect. It can be a really emotional, confusing process if people hear at the beginning, we're doing a pay equity study, and then they never hear anything about it again. So this is another time that having that HR person, someone from finance, someone from legal, having a group together from different parts of the organization for us to work with can be really helpful. Next slide. Some other tips and tricks that we recommend are making sure that the organization from square one has a compensation philosophy that applies across the whole organization. And what that means is saying, here's how we want to pay, here's how we think about compensation, here's how we think about benefits. If the market, depending on how the market data comes out, we always want to pay at this percentile of the market, having a philosophy so that things don't have to be done on an ad hoc basis. Additionally, standardizing and documenting rationale around leveling and pay descriptions. So again, this is to make sure that you don't have to do things on an ad hoc basis. So defining what it means for a role to be at one level versus another, and documenting when someone is promoted, when someone is hired, why they are at the level that they're at, why they're at the pay level that they're at, so that it isn't done because somebody's in a rush. And finally, throughout the organization, making sure that managers are trained in how to administer the compensation system, because this can be another area for differences. Is if one person is administering it one way and someone else is administering it the other way, then even after you have done the compensation and pay equity analysis, it won't continue to be relevant if people's salaries are then, raised or lowered or anything without any kind of system to it. So everyone needs to know how the process works. So with that, that's all I've got. I can turn it back for the next stage.
Thank you, Anna. Thank you very much. That was super interesting. So now, do we have any questions that were put in the chat?
We did not.
Okay. Well, please feel free to send us questions that you may have after the fact. You can email anyone on the team. I want to give another reminder that we will have webinar 3 in the series. That will be next Tuesday, December 13th, 2022. Please go to our website at chcdiabetes.org to register. And before you go, please take a few minutes to help us improve our future sessions and activities by filling out the evaluation. Also, if you have any ideas that you want to take a deeper dive in as we start to plan our winter learning collaborative, this is an opportunity to let us know. And if you don't have time today to complete this survey, which will pop up at the end of the webinar, we will send you the link in a follow-up email by Monday. And lastly, if you'd like to receive continuing education units for your participation, there are a few additional questions in the evaluation. And if you need to contact somebody at MCN, Martha Alvarado, her email is on the screen. She will be able to help you. And we really want to thank you for being here today. Thank you to our NTAP partners for collaborating. And I want to thank particularly Fatima Smith, Jillian Hopewell, Anna, and everybody who participated. Thanks a lot and have a great day.